A 55-year-old male patient rushed to the ER department with history of chronic alcoholism from last 20 years and with complaints of vomiting massive amount of bright red blood. While examining the abdomen, you see engorged paraumbilical veins around the umbilical part. So what you just encountered is called caput medusae. And what is exactly happening right here? For understanding that, you will have to understand one of the most important plumbing system of our body, that is the portal vein. So I am Swapnil Banerjee, and here in this video we shall understand the anatomy of portal vein, and also we shall understand the Portocaval Anastomosis. So sit down and start making your notes. So firstly, talking about the anatomy of portal vein. The portal vein is formed behind the neck of pancreas at the level of L1 vertebrae, and it is formed by the union of superior mesenteric vein and splenic vein. In case of other veins, it takes the blood directly to the heart, but here in case of portal vein, it passes the low oxygen but nutrient rich blood to the liver before it splits into right and left branches into the porta hepatis. It divides into 5 important tributaries that you will have to remember. They are the left and right gastric vein, the paraumbilical vein, the posterior superior pancreaticoduodenal vein, and the cystic vein. Now when you are seeing the portal vein in an ultrasound, you will have to remember the dimensions of it. So the normal length of portal vein is 8 cm and the diameter of portal vein is typically less than 13 mm, around 8 to 12 mm. But when the diameter is more than 13 mm, then ring your alarms because it might be a patient of portal hypertension. Normally the internal pressure of portal vein lies around 5 to 10 mm of mercury. But when the pressure arises more than 12 mm mercury, then that is called portal hypertension. So now in patients of liver cirrhosis or Budd-Chiari syndrome, where the blood is unable to flow normally through the portal vein, there the blood backs up and it forces open the other anastomosis between the portal venous system and the systemic venous system, and there you find the engorged veins. These anastomosis are called Portocaval Anastomosis. So here you will have to remember 5 main locations of Portocaval Anastomosis. So firstly, site 1, the lower esophagus. So here the portal part comes from the esophageal branches of the left gastric vein, and the systemic part comes from the esophageal branches of the azygous vein or the hemizygous vein. Remember the patients with esophageal varices present with hematemesis or blood in vomiting. Now the site 2, that is the umbilicus. Here the portal part is derived from the paraumbilical veins and the systemic part is derived from the superficial epigastric veins. So here the engorged veins present like the caput medusae. Now site number 3, the anorectal junction. So here the portal part is derived from the superior rectal vein and the systemic part is derived from the middle and inferior rectal vein. One very important clinical tip here, never confuse these patients with the patients of internal hemorrhoids because they appear very similar. Now the site number 4, that is the retroperitoneal space. Here the portal part is derived from the colic vein, pancreatic vein or the splenic veins, and the systemic part is derived from the retroperitoneal lumbar or renal veins. Now site number 5, that is the bare part of liver. The portal part is derived from the hepatic portal venules and the systemic part is derived from the phrenic veins draining the diaphragm. So now you will never confuse again in the Portocaval Anastomosis. So now I hope you have the complete picture of the portal vein in your mind and you already know the answer that we have discussed in the clinical scenario at the beginning of this video. Subscribe to the medical files for more such important medical videos, and also check out our community tab because there we upload daily NEET PG pattern medical quizzes. Thanks for watching. Have a nice day. Stay safe, keep learning, and bye.